TAMIS is transanal microsurgery. It's a new, cutting-edge, minimally invasive technique for removing large, complex polyps in the rectum or even early cancers. It's what we call natural orifice surgery. This means that we perform the surgery through a natural opening on the body, in this case the anal canal, by inserting a small port and effectively doing keyhole surgery through it. TAMIS is organ-sparing surgery in that it avoids the need to remove larger sections of the bowel containing a polyp or an early cancer, and therefore there's less impact on bowel function, and in some cases it can avoid the need for a permanent stoma. If you're thought to be a suitable candidate for TAMIS, you'll be asked to come to hospital to have the procedure, which is performed under a general anaesthetic. This means that you'll be asleep for the operation. An anaesthetist will give you the medication for the anaesthetic, and then a specialised surgeon, such as myself, will perform the procedure for you. When we do the operation, we put a small port into the anal canal and we attach a gas supply to inflate the rectum so that we have a nice view of the lesion we need to remove. We then use some long laparoscopic instruments, including a cutting device, a retractor, and some scissors, to remove the lesion in its entirety. We then extract it through the port. We normally check again to make sure there's no bleeding and put some local anaesthetic into the area to keep you more comfortable afterwards. Most people only need to spend one night in hospital after this procedure and find it to be really quite comfortable. There are two main groups of people who'd make a good candidate for TAMIS. Firstly, older people who have lots of medical problems, who would be very high risk for having a long general anaesthetic and a major operation to remove their early cancer or even their polyp. And the second group is anyone else who had an early rectal cancer or a large complex rectal polyp, who didn't want to have a larger operation, or someone with a very low lesion who wanted to avoid the necessity of having a permanent stoma. If you've been diagnosed with a rectal cancer or polyp and want to know if it's suitable for this procedure, your scans, your endoscopy and your biopsy results will need to be assessed in a specialist MDT, where we sit down with a surgeon, a radiologist, an endoscopist, an oncologist and often a pathologist to make an assessment of all the information about your lesion and see whether it would be suitable for this. Sometimes it's necessary to repeat a scan or an endoscopy as we look for specific things to see if the lesion could be removed by this technique. Not all rectal cancers or polyps are suitable for this, and this is based on a specialist assessment. It's difficult to put hard figures on the success rate of the procedure because it is relatively new, so there's not a lot of published literature about it. However, most people feel that it is successful at moving large polyps and even early cancers without an unacceptably high risk of recurrence or leaving residual disease behind. One of the main advantages of it is that unlike removing lesions like this with a colonoscope, which removes the lesion in several pieces, the TAMIS technique removes the lesion en bloc in one piece, so that we can be sure if there is a cancer within it, it has been completely removed. In addition to this, because this technique involves removing only a small portion of the wall of the bowel, as opposed to a long segment of the bowel with major surgery, it has a lot less impact on bowel function, how your bowel works afterwards. After the surgery, you'll be asked to stay in hospital overnight so we can properly monitor you and make sure you're comfortable before you're discharged. After you've gone home, the specimen we've removed will be sent to the pathologist to be examined under the microscope. It usually takes about a week or so to get the results back from this. What happens next depends on whether the specimen was a benign polyp or if there was a cancer within it. Everybody will have a further endoscopic test to check the site where the lesion was removed has completely healed 3 months further down the line from the operation. If your polyp was completely benign, the only further surveillance you'll need is regular future colonoscopies to make sure you haven't grown any more. If there was a cancer in the lesion removed, you may require further treatment. This might be surgery or possibly chemotherapy or radiotherapy. But the nice thing about TAMIS is it doesn't preclude any of those further treatments. You will then be put into a 5-year cancer surveillance programme. that involves having CT scans, colonoscopies, and tumour marker blood tests at regular intervals to be sure that the cancer hasn't recurred.